professor at Health Services Research at the Faculty of Health, Medicine and Life Sciences. We have a lot of experience with the Oculus Quest 2 glasses in education. So we have several 360-degree videos, and students are watching these videos. Think of in home care, we also have a human cell in our glasses, and we integrate these elements, these activities in our problem-based learning programs.
I'm Mariam Asudar. I work at the Task Force Instructional Design and E-Learning at Maastricht University. Now, the rationale behind using AR, VR, MR in medical and health education is commonly based on limitations. Limitations like time, or aspects like breaking complex scenarios, providing a safe environment or a controlled environment for the students to learn in, also reducing cognitive load by manipulating different aspects of a task for the students while learning. Another encouraging aspect to use AR, VR, MR in education, in medical education, is to bring motivation to the students and also to help them with self-directed learning. It's good to know that AR, VR, MR have mostly been used in medical education for training surgery, for professional education or residency education, and also for anatomy for bachelor education.
Hello everyone, my name is Fatima and I'm a PhD candidate at the School of Health Profession Education at Maastricht University. When designing simulation for health education, applying instructional design principle can greatly enhance the effectiveness of the learning experience. By focusing on instructional design key aspects, we can create engaging and impactful simulations. But what are these key aspects? First and foremost, it's crucial to establish clear learning objectives. Next, consider the principle of active learning. To enhance learning transfer, provide opportunities for reflection and feedback. Moreover, consider the principle of scaffoldings. And lastly, ensure the simulation provide clear instruction and intuitive interfaces.
Hi, I'm Hao Yu. Introducing AR, VR, and MR into medical education opens a new world of possibilities, but it's not without its challenge. One of the major things we are facing now is we don't have a general instructional design to can guide our work with the advanced tools for teaching and learning. Yeah. And the second challenge is to exploring the educational benefit and add values to integrate these tools into medical education. Of course, we also cannot overlook the investment required for successful implementation. AR, VR, and MR technology demands significant resources, from the cost of and the technological infrastructures to the faculty training.
My name is Sanne Rovers. I work as an assessment advisor at Maastricht University's Faculty of Health, Medicine and Life Sciences. Biggs and Tang's theory of constructive alignment postulates that in order for meaningful learning to occur, alignment should be achieved between intended learning outcomes, teaching and learning activities, and assessment activities, in which intended learning outcomes are used as a starting point. As such, to begin with, it is important that AR, VR, or MR activities are set up in service of relevant intended learning outcomes. And when looking at Miller's pyramid of clinical competence, which separates learning objectives into different levels of knows, knows how, shows how, and does, AR, VR, or MR activities would fit well for learning objectives at the shows how level, in which learning and assessment is carried out in authentic yet controlled situations. Assessment activities should fit with this level as well, either in the AR, VR, or MR environments as well, or by attempting to transfer to other controlled settings.
Hi there, I'm Zen Li. My research is about simulation with virtual patient and how to integrate in the class. So what virtual patient is like a training partner that we use in the world of medicine. It gives students a chance to practice crucial skills like clinical reasoning, communication, and problem solving without worrying about real-world consequences. Thinking about being able to take risks, make mistakes, and learn from them in a totally safe environment. There are many options for virtual patient. A virtual patient can be very cost-effective and super easy to use, and can still give a student a taste of real clinical situations. On the other hand, virtual patient can also offer a high-end experience. We're talking about immersive 211. We're talking about virtual reality here. So whether we keep it simple or going it all out, the main purpose is to improve the learning in class. And this is also what my study focuses on.